coming up on the Get Lean, Eat Clean podcast.
But there's other regenerative treatments as well. Like, for example, TED, Transepidermal Delivery, which uses growth factors and peptides, which are non-pharmaceutical. And we push those through the skin using ultrasonic sound waves, which break up the skin layers that are normally protective and barrier to moisture. We dysregulate that moisture barrier, push those serums through the skin, and we can get a very, very nice hair growth effect without having to use any needles. So TED is pretty exciting. That's a no drama, no trauma, as they say, type of treatment.
Hello, and welcome to the Get Lean, Eat Clean podcast. I'm Brian Grin, and I'm here to give you actionable tips to get your body back to what it once was 5, 10, even 15 years ago. Each week, I'll give you an in-depth interview with a health expert from around the world to cut through the fluff and get you long-term sustainable results. This week, I interviewed Dr. Alan Bauman. He's the founder and CEO of Bauman Medical, an international leading treatment center in the field of hair restoration. He's been at the forefront of exploring the connection between hair loss and biohacking. We discussed some of the main causes of hair loss in both men and women, lifestyle habits to help prevent hair loss, latest advancements in hair restoration, supplements for strong hair, and much, much more. Really enjoyed my interview with Dr. Bauman. I know you will too. Thanks so much for listening and enjoy the show. All right, welcome to the Get Lean, Eat Clean podcast. My name is Brian Grin. And I have on the show Dr. Alan Bauman. Welcome to the show.
Hey, Brian, great to be here with you.
Yeah, great to have you on. Just learned you're not from originally, but you're in the Boca area in Florida, and top hair restoration surgeon. What led you down that path?
Well, no one's ever born into the world of hair transplant surgery, and certainly I didn't think that I really didn't know anything about hair transplantation until many, many years into my career. But my career in medicine, if you ask my grandmother, she probably would have said, when did Alan decide he wanted to go to medical school? If you asked her, she probably would have said, the day he was born. Mm-hmm. And so it was kind of a preordained thing, I guess, and maybe an arranged marriage. But at least I was good at science and math enough to pursue the career. And obviously I had a lot of encouragement through my family to continue to do that. And I always loved helping people. So it was just kind of a natural thing. But I did have the unique opportunity when I was really before I had a chance to drive a car. When I was a teenager, I met a very prominent plastic surgeon in New York City, and he invited me to watch him operate. And that had a huge impact on my direction in terms of, what I wanted to do with my life. He showed me really the artistic end of surgery as a plastic and reconstructive surgeon. I thought that's what I was always going to do. And it wasn't until I went many, many years later into internship residency in surgery, and then eventually met a patient who had a hair transplant. Mm-hmm. And I thought that all hair transplants, like most people probably think, that it's pluggy or painful. Like, why would you ever do that? And at the time in the mid 1990s, plugs were kind of the rule, like grafty looking results. But this guy's results looked amazing. And so it really fooled me, actually. We had an interesting conversation about that, how he chose the surgeon he chose and where he went. And from a layman's point of view, the technology, which was single follicle implantation. And I took a strong look at his hairline and really was interested to learn more. And that kind of started me on my journey. But I would say, looking back, probably one of the more important things I remember about that conversation was how he said that the hair really changed his life, and the impact that it had on him, both socially and professionally, kind of stuck with me. And it kind of gave me that fuel to look into it further, in addition to the other things I was doing in the world of cosmetic procedures and treatments. Mm.
Yeah. And
so that was, almost 30 years ago now. I did a fellowship, or actually a preceptorship, in hair transplantation after visiting many, many clinics around the world and going to conferences and reading all I could, and eventually decided to go into hair restoration full tilt, 100% as a specialist at that time, and moved to Boca Raton really in 1997 to open up the practice to exclusively perform hair transplant surgery. And so it's been a great journey. I've treated over 33,000 patients, performed over 12,000 surgeries, done over 13,000 regenerative treatments like PRP and such. So it's a fun practice to have, and we change lives every day.
Yeah, that's great. And what would you say some of the biggest things that you've learned through all the patients that you've treated throughout the years and the surgery you've done? What are some of the biggest things you've learned?
Wow. Well, probably one of the most important things I've learned is just how emotional the hair follicle is, right? And what I mean by that is the effect that it can have on a person. Whether you're a man or a woman of any age, we have teenagers dealing with alopecia spots. We have young men dealing with male pattern hair loss. We have women who are dealing with PCOS and losing their hair traumatically. Obviously, more recently, we're dealing with COVID. And of course, medications and menopause and all the other things that you can imagine that dysregulate the hair follicle. And we can spend hours and hours talking about all of the different little micro regulations that happen at a cellular level. But, I like to always just take a step back and realize that, when someone's losing their hair, they're losing a part of something that they typically liked and that they want to keep. And if they've lost it, they definitely want to restore. So, hair, like I said, if you're having a bad hair day, you know what that means. That's a pretty common, well-known phrase in our world. And when somebody says to you, "I'm having a bad hair day," wow, look out! Don't come messing around. But and so it tells you on the flip side, when you restore someone's hair, what I've learned is that it can really make an incredible change in people's lives, making them feel more confident, look more beautiful, look more resilient and youthful, and just more vital overall. And I'm included in that. I love my hair. I want to keep my hair. And so I'm on that bandwagon too.
Mm.
And so that's what we do here day in and day out at Bauman Medical. We help patients look good and feel great by helping them maintain, enhance, and restore their own living and growing hair, no matter how minor it is, if they're at risk for hair loss or if they've had severe hair loss through an autoimmune condition or an injury or trauma, or simple hereditary causes or metabolic disorders. So.
What would you say some of the main causes of hair loss are?
Well, the number one cause that we see in the practice really is genetic. So there's always some genetic predisposition. And, we can see male pattern hair loss from across the room, right? It starts with a receding hairline, maybe a thinning in the crown, and that gradual miniaturization of the hair follicles lead to baldness. And you could lose all of your hair across the top, right? My dad went bald when he was in his 30s. And but in female hair loss, even though it also has a strong hereditary component, typically sparing the hair in the back of the scalp, it can really thin out the frame of the face, and especially the front and center can start to weaken. But it's a little bit more of a diffuse hair loss in the beginning stages, although it can get more severe and recede the hairline as well later on. So hereditary causes are the primary thing that we see. But as I think we talked maybe even before we got started, that hair follicles are very, very sensitive to your body's metabolism. They're very sensitive to your nutrient and fuel intake. They're very sensitive to inflammation. And so if you have inflammation on the scalp, that could definitely aggressively cause the hair loss process that you have to progress faster and more profoundly over a short period of time. If you are depleting yourself of nutrients and fuel, either in a weight loss program, purposefully, or maybe you realize that now that there's something missing in your diet, like adequate protein or something like that, that could really affect those highly metabolic organs, which are the hair follicles that produce the hair fiber, right? So hair fibers are dead. The follicles are alive. The fibers are like 3D printers. They make the hair fiber that we see and touch and style and cut and all that business.
And speaking of just lifestyle, like lifestyle changes could people make, or are there certain things that maybe could help? Like you said, it's probably a lot of genetics involved, but like what other things could people do just lifestyle wise to help with prevent hair loss?
Well, obviously stay resilient, stay healthy. We've seen so much, for example, COVID related hair loss, right? So whether you're having a surgical operation in a hospital, or you're dealing with a dramatic infection in your body, that can really dysregulate the hair follicle. So keeping your immunity up to speed and supported is good. And of course, there's lots of ways to do that, including supplements and such. Making sure that your scalp is healthy. So if you have itchy, dry, flaky, oily, some kind of scalp health issue, some symptom up there, you definitely want to get that checked out. And so, for example, I have a full-time trichology department run by my trichologist, Kimberly, here in the practice to help patients who are dealing with scalp health issues. And that's a huge part of the practice because nearly 50% of people at one time or another are going to be dealing with some scalp health situation. And so there's, the scalp has its own microbiome. The amount of sebum or oil that your scalp produces can change with age, and that could necessitate a change in your hair care regimen and your styling. And all these things can cause a unique environment, which may not necessarily be so great for hair growth. So definitely want to get that checked out. So I always encourage patients, men or women, especially women going through perimenopause or menopause who might be experiencing some hair thinning, to get a full workup. We do a complete medical history and biomarkers and such to see what's going on. And our male patients too, we always want to know what's happening, at a cellular level, and our biomarkers and DNA testing and things like that can certainly help elucidate if there's some underlying causes of hair loss, or if the hair loss doesn't fit a certain pattern, right? We talked about receding hairline, thinning crown. If the hair loss is looking different than that, then we need to figure out why.
Gotcha. And then what about, I know there's supplement industries like probably overcrowded with different, treatments for whatever hair loss and things like that. Are there certain supplements that you see that might be more effective than others?
Well, I do think supplementation is important in this day and age. I really think our nutrient fuel intake is dramatically, poor and depleted of good quality nutrients and fuel. And I think it's very important to maintain a good supplement regimen, considering what's available out there. And I'm not just talking about fast food restaurants, which is just the worst processed food you could eat, but even stuff you find in the supermarket can sometimes be not so good for your health, obviously. And as we said, hair is an important barometer of that. So I've actually developed my own hair care products, specifically a wellness system for hair supplement line, to kind of hit the main points. So a lot of people don't take, especially young men, for example, they may not take necessarily multivitamins. So I want to make sure they get a good multivitamin with B complex and things like that. Protein intake, we mentioned before, that's the fuel that's going to build a hair fiber. So you want to make sure that your protein intake is adequate. And so I'm not saying you need to be like, a carnivore keto guy, but, you want to make sure your protein is right on point. And especially if you are a vegan or vegetarian, that you be mindful of that. That's one of the most common things that we see, that people are vegan, vegetarian, they are undernourished, and they're not going to build good hair fiber typically, and they're not going to heal as well from surgery. And so that's important. If you need a hair transplant, you definitely want to build up your protein intake. So we do have collagen protein. Obviously, that's not a vegan option, but collagen is part of it. Biotin, everybody kind of born with the knowledge that B7, vitamin H can help with hair. It's not a miracle cure. And none of these supplements are really miracles, but they're foundational, right? The follicles are engines, right? They're mini organs. They're trying to do things, with that nutrient and fuel supply to build that hair fiber. So decreasing inflammation, maybe with some herbs and other supplements, adding to that regimen with, other things like ashwagandha to decrease the effects of stress, which stress cortisol, the cortisol hormone, very, very detrimental to the hair follicle, prolonged exposure. So those are some of the things that we have in the wellness system for hair. It's under the Bauman MD line, for your listeners, now on Amazon, I guess. But, I can give you some additional information. So the wellness system for hair is the foundational nutritionals. And then we have a hair care product line, which also has some hair growth products in it as well. But those are not magical miracle cures. We have to get into medications. We have to get into laser light therapy. We have to get into regenerative medicine if we're really going to protect and enhance hair follicle function. So those would be the next steps.
And what would you say, what are some of the latest advancements in hair restoration?
Well, latest advancements come in a couple of different flavors, I guess. So there's advancements in the non-surgical treatments, right? So these regenerative treatments that we do in the office. We have a much more sophisticated method of applying, for example, PRP, platelet-rich plasma. That's a treatment that you get if you have a tennis elbow. You put PRP in there and it'll help it. If you've got a bum knee, and it's not bone on bone yet, you can do PRP there. PRP for the scalp with the appropriate amount of platelets and concentration can really get a regenerative effect as long as the follicles are not dead and gone. And so we found 10 to 12 billion platelets per treatment is really the magical dose, the sweet spot, if you will, for hair growth and also for wound healing after hair transplants. But there's other regenerative treatments as well, like, for example, TED, Transepidermal Delivery, which uses growth factors and peptides, which are non-pharmaceutical, and we push those through the skin using ultrasonic sound waves, which break up the skin layers that are normally protective and barrier to moisture. We dysregulate that moisture barrier, push those serums through the skin, and we can get a very, very nice hair growth effect without having to use any needles. So TED is pretty exciting. That's a no drama, no trauma, as they say, type of treatment.
How long
But you
have
got
you
to
been?
come into the office.
Yeah, how long has that been going on? How long have you been doing that for?
Oh, TED is about at least 2 years old already. A lot of the research was done in your neighborhood, in Chicagoland area during the pandemic. We were one of the first to be qualified to provide that for patients here in North America. And I've lectured on that topic, presented on that topic in our pilot studies internationally, actually. And actually I'm slated to present again within the next couple of weeks internationally on the effects of TED. We've had a really profound response in terms of hair growth with the TED procedure.
Hmm. And that's what does TED stand for again?
TED is transepidermal delivery, and it
Okay.
uses a technique called sonophoresis. Sonophoresis has been around, for many, many decades. I'm talking like since the 1960s, I think, or even maybe even before. Orthopedic surgeons used to use what they called phonophoresis, which was sound waves to push corticosteroids in and around the knee for inflammation, right? So there's this kind of technique has been around, but not with the growth factors and peptides that we now know stimulate hair regrowth.
Hmm.
So it's this magical combination of the technique of applying it without having to do an injection, and then using these growth factors and peptides right on the scalp that are potent, like fibroblast growth factor, vascular endothelial growth factor, VEGF, and using copper peptide and thymosin beta 4 derivatives and things like that. Very, very powerful growth factors and peptides, along with amino acids and such in that treatment. So you got to come in for that treatment into the office. It takes about an hour, less than an hour, maybe half hour, once a month for 4 months to really see some improvements.
That's what I was going to ask, if it's an ongoing treatment. So typically 4 months of treatment.
4 months, and then we let it grow. Obviously, we know that, for example, our PRP treatments, in contrast, with a single treatment, 10 to 12 billion platelets, we're going to get about a year's worth of growth out of that, 10 to 14 months. With TED, it's a little bit more unknown because we just don't have as many patients through that process yet. But stay tuned. We're tracking everybody, so we'll know, do we need to repeat that package of series, if you will, before the end of the year, or do people last a full year or longer? I think a lot of it depends on some of the other therapies that they might be doing, pharmaceutical interventions, laser light, as we mentioned before, or even hair transplantation, of course.
Mm. And then what would you say some of the misconceptions around hair restoration are?
I think probably the biggest misconception still remains, even the one that I had almost 30 years ago, is that hair transplants don't look right, that they don't look natural in some way, shape, or form. That they're either pluggy looking, or the hairlines aren't normal or natural, the hair doesn't grow in the right direction. And of course, that depends on the technique, right? Or that they're very painful and invasive. And of course, that's not the case as well. So with the newer techniques, we can take the individual grafts now one at a time from the back of the scalp without having to remove a strip of skin like the days of old. So there's no stitches or staples anymore with this newer technology. Of course, it's not equally distributed, but there are many practices out there that still perform the old style linear harvest, and that's okay. That's what they're good at. But for over 15 years, we haven't taken a strip procedure. We haven't taken a strip harvest in any procedure. We only do what we call FUE, follicular unit extraction. And so that gives me unique control over the angle, the orientation, the position of every graft, every follicle, therefore, that goes into the scalp. So using an artistic eye, we can create a hairline that's soft and wavy. It's not a straight line or a wall of hair. You can get those, if you travel, to foreign countries, certainly. There's a lot of that going on. Usually those results are pretty bizarre looking. They're not normal, natural hairlines. And we want to create a hairline that is undetectably natural, something that doesn't look like it was contrived. And that's, again, the technology of a no scalpel, no stitch harvesting. So there's no linear scar left to hide. And then the artistry in terms of hairline design and the implantation techniques to create the final result so that it blends and looks normal. It doesn't look weird. So I think that's a very common misconception. And also the pain control right now is exceptional. I mean, most patients after the procedure, they don't need a narcotic pain pill. Most patients will take a Tylenol or Motrin at night, and that's really the end of it. Back in the gym in 3 days, crusting is done in a week, and they're back to regular routine very quick.
And how long would you say they have to wait to see some hair growth come in?
Great question. So right after the healing is done, which is about a week or so, the skin is back to normal and the stubble we've implanted is shed. So you don't see anything for months on end. It takes about 4 to 5 months to start to see a little bit of growth coming in. And it happens slowly. It's not like all the grass in the yard comes up at the same time.
Hmm.
It happens little by little over time. And what you'll see is by 6 months, you'll see about 50% of the final result, but it takes a full year to grow to 95%. So it is kind of a slow growing process. But remember, those transplanted follicles are now going to be relatively permanent. They're going to be unaffected by male pattern or female pattern hair loss. And whether we're putting them in the bald spot or the hairline, they'll live and grow there lasting. They'll be there for a long, long, long time for sure.
Uh, I'm curious. We talk a lot about routines on this podcast. Like, I'm a big morning and evening routine guy. I'm curious, just your lifestyle and what type of routines have you implemented into your life?
Oh, for me personally, well,
Yeah.
aside from my hair care and scalp care routine, which I do like for my patients to tie to their circadian rhythm, by the way, we actually developing an app for that. That'll be based around my hair coaching program. So we'll have a hair coach app that you could have in your pocket that will help track your sleep, help you get better sleep. So we reduce your stress, but also create that regimen, because oftentimes treatments for hair, for example, are done in the evening and in the morning. And so like before bed, it might remind you to use your laser light device. Take your medications, whether it's finasteride or minoxidil. And then in the morning, remind you again, whatever, it is that your routine might be. Now, me personally, my routine on weekdays starts pretty early, 5 a.m. I'm up and at it. And, I start out usually with a green drink, and then coffee, basically. I don't really have a breakfast meal other than that green drink. And then usually I'll have my first snack at somewhere between 1 and 2 o'clock. So having, fasted really overnight from about 7 or 8 o'clock at night. So mostly a 16-8 window is kind of what I'm looking at most days, but it just varies. On the weekends, kind of anything goes. If it's I want to be more social, then obviously, a brunch may be included in the weekend activities. But I'm at the office by 6 o'clock. We operate every day, Monday through Friday, usually handling 1 to 3 cases per day, in addition to the full cohort of consults and follow-ups that we do. But I also have some help. I have my team of surgical technicians who will assist me with these long and labor-intensive procedures, these labors of love, as we say.
How long do the procedures normally take? Yeah.
Well, patients are usually in the office for a surgical procedure during the day, about 6 to 8 hours, in the chair. And then there's breaks for lunch and restroom and such. We give them some snacks and so forth. You can watch some movies, listen to music. By the end of the day, the team might be doing some karaoke. It just depends.
Mm-hmm.
But it's a pretty comfortable day. Most of our professionals are pretty psyched to have a day where they just have to sit and do nothing. Not have to worry about much. You can answer obviously text messages on your phone or watch something on an iPad if you want, but we've got, big TV, LCD screens in the operating rooms and such for comfort.
Mm. Very cool.
So some cases actually go multiple days. So they might go 2 to 3 days long, depending on whether we're harvesting just beard or scalp and beard as well. Because we do use a lot of beard in the practice. A lot of our patients have had depleted density from their donor zone from old style procedures performed elsewhere and are looking for an alternative source of donor. And so one of my specialties is using beard transplantation, taking the beard follicles and applying those into the scalp and where appropriately needed to increase density and coverage up there.
Interesting. Awesome. And go ahead.
I was just going to say, some of the other specialty cases that we handle, eyebrow transplantation is a big part of the practice, both for men and women. Eyebrows frame the eye, make you look younger. For women, an aesthetic shape to the eyebrow is obviously very, very important for framing the eye and the face. And then eyelash transplants are also a big part of the practice. Probably one of the only surgeons in North America that routinely does eyelash transplantation on a regular basis.
Interesting. And you and Bauman Medical Group, and you're in Boca, right?
Correct. Well, Bauman Medical was established in Boca. I came down to Boca in 1997 to build the practice, to start the office, and we've been in Boca Raton for over 25 years.
Wonderful. And if you were going to give question I ask a lot of guests, if you were going to give one tip to an individual and they were looking to get, let's just say, their body or their mind back to what it once was, what one tip would you give that individual?
Their body or mind? Well, I think, some people ask, well, what's your favorite biohack, doc? And I have to say gratitude is the number one thing. I mean, it's free. It sometimes takes some practice if you're not used to being thankful for things. Obviously, here in our part of the world in America, we have a day for Thanksgiving. And so, that's a day of gratitude. But I think part of my routine that you asked about was, being mindful about gratitude at least once or twice a day would be a good, smart way to start things. Of course, I sleep hack. I mean, I've been wearing an Aura ring for 5 years. I got the third gen Aura ring. I'm really keen on trying to fix my sleep. I think it helps in so many different areas of my life. I try to protect my sleep very well. I try to, wind down, get off and away from screens appropriately after dark if I can. Not always so possible, in the modern age of running a business and presenting internationally and things like that. But I do my very, very best to try to protect sleep. I think, and I encourage my patients to do the same. I think it's really important for health and wellness, for mental function, physical function, and recovery. I mean, if our bodies can recover better, then we're going to perform better, and we'll be able to stretch and even enhance our abilities both mentally, physically, and hopefully, put more, not just years in our life, but more life in our years,
Yeah. No, I love that. I mean, prioritizing sleep is like probably the number one principle I'd say that most of the time we talk about on this podcast. So,
wow.
Yeah, that resonates a ton. Well, this was great. Yeah, go ahead.
I was going to say my sleep hero is Matthew Walker. He's always been able to clarify, elucidate how important sleep is. And I feel like, having been a surgical resident, in my early stages of the career and working 140 hours a week and all of that, that may have had a strong impact and really accelerating aging, even though, we were more resilient at that age when we started.
Right.
I think that had a strong impact on my ability to kind of wind down. So I don't know what the permanent effects of that were or are, or if I was just, genetically programmed, maybe not to sleep as well as somebody else, but definitely something I try to work on.
Yeah. And like you said, winding down, getting away from screens a few hours before bed. I mean, those are big, and even some type of meditative practice. It doesn't have to be a long meditation, right? Like 10 minutes can help as well.
Absolutely. Internally, focusing your stuff internally, maybe shutting out the world for just a moment. And
right.
like you said, 6 or 12 minutes, I mean, can really reset your system. And, and I would certainly encourage breath work with that meditation to kind of reset the mode. I think that's probably the quickest way to change your mode, from activity to relaxation, is breath work, really.
And I noticed on your, I don't know, it was a website or your one pager, you got Dave Asprey on there. Is that someone that you've met through the years or just?
Oh, yeah. So Dave Asprey, I've been a big fan of Dave since 2016. We met at the American Academy of Anti-Aging. He was keynoting on Bulletproof Coffee, I think around that time, maybe even a couple of years before that, probably. And, that kind of changed to my dietary regimen, giving up kind of this big, heavy protein and carb shake in the morning, which was supposed to keep me full all the way through, lunch. Never did, by the way, spiking my glucose probably or whatever. But so Bulletproof Coffee was really one of my first biohacks, I think. One of the first things that I did to kind of change, my nutritional regimen. And that helped me get into intermittent fasting and then eventually into 3 and 5 day water fasting occasionally. But Dave eventually became a patient at Bauman Medical. He's one of our most public patients, well known in the sphere of health and wellness, obviously as a New York Times bestseller, and all of his followers there, through social media, and his podcast, obviously one of the most prolific podcasts for health and wellness. And so when he came in for his hair transplant, we talked about what he wanted in terms of a hairline, and he went through a whole scalp makeover process with my trichology team, and then we put him through the hair transplant process to restore the hairline and put him on a path to maintain, enhance, and restore his hair so that he could look amazing when he turns 180.
Yeah.
But
right.
So Dave is, I'm a big fan, and of course, as a patient of mine who's very public about his results and what he accomplished with it, it's been very, very helpful to us to help others who are kind of contemplating, maybe going through a hair transplant procedure, but don't really know what it's all about. So they can look up Dave's experience and his story and how he went through it, and also how he recovered basically in half the time as a normal patient. As you can imagine, he knows how to biohack it, right?
Yeah. Yeah, no doubt. And so where's the best place for people to find and learn more about Bauman Medical?
Yeah, the most important thing to do if someone is out there and they think that they're either at risk for hair loss, or they've seen it personally, either in the shower, in the drain, or they're looking at themselves in the mirror with a receding hairline, less coverage of the scalp, for the women or men with long hair, weaker ponytail volume, or some kind of a change to their hair that they don't like. The most important thing to do is to start early, take action, don't wait, because early intervention is always going to be profoundly more impactful when it started, sooner rather than later. Obviously, that early intervention is critical. So you can go on the website at baumanmedical.com, BAUMAN medical.com. You can find me on all the social media platforms too. But if you go to the website, there's thousands of pages of information that I've personally written over the past 25 years, all about hair loss. There's hundreds of hours of videos. I promise you won't get bored of those if you're interested in hair. And of course, dozens of podcasts and interviews in the media, as well as traditional media, as well as electronic media. So you can kind of get a handle on how things have changed over time. But then the next most important step is to schedule that consultation. And even if you're not local to South Florida, we can start your hair restoration journey through a virtual consultation, just like I'm talking to you today, Brian, on Zoom. We do every single day, start patients with their journey, learning about their situation, looking at their photos, examining their hair through virtual consultations. And nearly 50% of my patients will start their journey through that virtual consult from their home or phone. But of course, if you're coming down to South Florida, you want to make a visit to us. We got a 12,000 square foot facility, 35 team members to help you, and me, of course, as well as lots of technology to help measure your hair, to track your hair loss over time, make sure you're getting great results, no matter what. You've got to take strong action early, get measurements, get benchmarked, and then put a sophisticated plan together. Whether it's regenerative or non-invasive or surgical, let's figure out what you need and get you to the end of that journey.
Excellent. Well, I appreciate you coming on, and maybe this has enlightened some people to take a look if they want to learn more about you, or if there's some group in their area that they want to check out and learn more about. But I'll put links in the show notes for, obviously everything you do. So I appreciate you coming on the podcast today and sharing all this knowledge.
Well, Brian, it's really been great. And hopefully we can impart that information to your listeners, your followers. And like I said, if anybody has a question at any time, you can always reach me through social media, or even, like I said, at baumanmedical.com/ask. And you can just ask your question about hair loss right there and get a hold of me. And of course, I'll respond through my team and get you the information that you need. But it's been great to be with you, Brian. Thank you so much for having me.
Thanks, Alan, for coming on. Thanks for listening to the Get Lean, Eat Clean podcast. I understand there are millions of other podcasts out there, and you've chosen to listen to mine, and I appreciate that. Check out the show notes at briangrin.com for everything that was mentioned in this episode. Feel free to subscribe to the podcast and share it with a friend or family member that's looking to get their body back to what it once was. Thanks again, and have a great day.